we had a session about multiple myeloma biology and pathophysiology, but I think it's a very important topic to start with in this type of meetings. So we spoke about the genomic complexity of multiple myelomas, what are the driver events, and also what are other events that could be important in the myeloma development. And here, for instance, well, we spoke about as a driver, the 414, the IgH translocation and the hyperdiploidy, but there are others that are also important, such as MYC, for instance, or 1Q gain or amplification. And I think that was something that is coming more and more as a high-risk disease. Also, we spoke about outside the plasma cells. We also spoke about the microenvironment. We know that it's very important, the influence of the microenvironment. And Paula Neri spoke to us about how this is important in the progression from MGUS and smoldering myeloma to the active disease of multiple myeloma. Jill Kaur spoke about the subclonality. This is interesting because Gareth Morgan in the first session and Paul O'Neary spoke about how myeloma is a very heterogeneous disease, but in the case of Jill Kaur, she spoke about inside the patient that there is also high heterogeneity. We have a subclonal disease with different clones inside it, and also there is a spatial heterogeneity. We have different myelomas, I would say, in different parts of the body of the same patient, and this has also, of course, therapeutic implications. Then the last one was, there was two last ones. Nithar Bali speaking about the influence of mechanisms of resistance to immunotherapy, and I think that was also, this is something that we are more and more facing now, that how to address this resistance, these mechanisms of escape of patients, of the tumor cells. And we spoke a lot, and this was also in line with the previous talks about the T-cell exhaustion, how there is the immune system is compromised, and how this can affect the role activity of T-cell engagers and CAR-Ts, for instance. And also at the end, we also spoke about the target downregulation, particularly in this case with BCMA, that is the main target for these drugs, and what are the main mechanisms of the BCMA downregulation. In fact, he spoke that was in the case of BCMA, it's very important, the genetic deletion or mutation in the BCMA locus, which is not so important, but it might be for the CAR-Ts. And the last talk was about the microbiota, and this is also some hot topic that we know that the type of microbiota, the distribution of microbiota, what are the main microorganisms we have, particularly in the gut, could influence the outcome of patients. This is something which has been shown in autologous stem cell transplantation, but this is also something that is now being explored in the terms of lenalidomide or other fields in multiple myeloma. So I think it was interesting and as a background to go now into the therapy of multiple myeloma.